logged in at the moment, so others may wish to hear the recording at a later stage. So this is the second seminar in a series of seminars on it, and this one obviously is in evaluation. There's a further seminar for the 6th of March, so if you want to make a note of that, that will be on evidence synthesis, and it will be advertised on the DNCC email in the next day or two. So obviously make sure you register for that event. Do you want to go on to the next slide, Michelle?
Oh,
Uh,
sorry, I'm having trouble advancing. Let me just see. Yeah, there we go.
Okay, so my name is Austin Waters. I'm the research lead in CH09. I'm also co-director of the REACH Collaboratory, which is a formal research collaboration between the HSC and DCU. We have a number of research projects. Michelle, if you want to go to the next slide. We have a number of research projects underway, and if you would like to know any more about those research projects, you can contact us at that email there, reach@dcu.ie, or alternatively, you can contact me, Austin Waters, at hse.ie. Anybody who knows me, Waters is spelt a little strange, so just make sure you get the spelling of that correct, but you're more than welcome to reach out to myself. Towards the end of this session, there'll be an evaluation sheet, and if you have any thoughts or comments on future events, we'd be welcome to hear from those. So if you want to go to the next slide, Michelle. So I'm going to introduce Michelle Butler, Professor Michelle Butler from DCU, who's going to begin our session today on approaches to evaluation in health and social care. That will be followed by Gail Nicholson, who is a member of staff in the Health and Wellbeing Division, who's going to talk about a practical approach to evaluation that she's involved in her own service. So we hope then to have about 10 to 15 minutes of questions after that. If you want to pop any questions into the chat as we go along, we'll try and keep track of those. Otherwise, Michelle, I'm going to hand over you to make a start.
Thank you, Austin. And thanks everyone for coming along today. I know it's a very busy time for everyone, and you're probably giving up your lunchtime, so we do value your participation in this. And of course, in the time, we can only just do a sort of an introduction to the whole idea of evaluation and to the processes involved and so on. But as Austin said, if you would like to follow up on this, or if you'd like some support with something that you're working on, please feel free to contact us. So to begin, I'm going to spend the next 30 minutes just looking at some of these topics. First of all, clarifying what we mean by evaluation and how is it different to research, and that's important, and we'll talk about why that's important. What do we really want to achieve from evaluation? So what is the aim of evaluation? We'll look at that. And then just before you begin, just be thinking about some of the things we might want to consider when designing an evaluation. We'll briefly look at the key steps in the process, and then just have a look at some evaluation frameworks, which can be useful in terms of helping us decide what we do and how we do it. My own background, I've been involved in evaluation and research for the last 30 years. In fact, my first research position was as the research midwife on a national evaluation of direct entry midwifery education programs in the UK. It was a 3-year evaluation program, so it was a really big evaluation. But evaluations can be anything, from the evaluation we'd ask you to complete after this, a very short, sharp evaluation, to that big bang evaluation. And it's up to you to decide what you want to achieve and the resources you have to achieve that. So we'll look at some of that today. So what is evaluation? I think it's important to clarify what we mean by that. And I have 2 definitions here. One is from the OECD DAC, and the other comes from your own website. So the DAC referred to a systematic analytical studies conducted occasionally or on an ad hoc basis to answer specific management questions about performance. So the ad hoc piece is important. It's something that we stop and take stock of what's happening. And also the specific management questions about performance is important too. It's really about the initiative that you're concerned with. We're not necessarily concerned with sharing that, but we might. And the second definition from the HSC website is that it seeks to address how well a service is achieving its intended aims. It's undertaken to benefit the people using a particular healthcare service is designed and conducted with the sole purpose of defining or judging the current service. So there is very much that focus on the particular service. Okay, so just to clarify how it's different to research and why is that important? Well, there are different requirements and obligations in terms of conducting research. So we'll talk about that in a minute. But, research generally is designed to generate new knowledge that contributes to the knowledge base. It's generally designed to be generalizable and transferable. And it may be testing hypotheses or generating new ones to be tested. So it's much broader than your particular project or your particular initiative that you're focusing on. Clinical audit is very similar, except the focus there is very much on the quality improvement process, and there are specific approaches to doing that and particular criteria you might want to include. Monitoring is similar in to some effect, and you may actually use the results of either clinical audit or monitoring in the evaluation as a source of information. But monitoring is, the day-to-day or the ongoing tracking, if you like, of the performance of the initiative or the service or whatever it might be. But the data that you generate from that can be very useful in terms of conducting that evaluation. So in terms of the research, I suppose the distinction is that if you're conducting a piece of research, generally you may well require ethics approval. Generally for clinical audit or for monitoring or for evaluation, you don't. But there may be circumstances where, if the service is very sensitive or there are particular challenges there from an ethical point of view, you may want to discuss with the ethics committee about whether or not you need ethics approval. Nonetheless, you will need to be mindful of GDPR and data protection requirements. And generally, if you're using personal data, there are particular requirements around that. So what I would say is, it's useful just to check either with the ethics committee or with your data management department about what are the requirements for your evaluation. Okay, so one other definition of evaluation is program evaluation. And you will see lots of different definitions of evaluation. But I think the types of evaluation that we're conducting in health services tends to be either program evaluation or an education evaluation. So from the program evaluation, when we say program, spelled sometimes with one M or sometimes with two, what we're talking about is either, something like a vaccination program, a screening program, a service that you've set up or initiative you've set up, or a new way of doing things that would be considered to be the program. And in terms of program evaluation, what we're talking about is the systematic collection of information about the activities, the characteristics, and the results of programs to make judgments about their merit, worth, and the significance of the program, to improve or further develop program effectiveness, to inform decisions about future programming, and or to increase understanding. So there's an awful lot of different things we might want to do from the statement. Depending on where you're coming from, you'll have a different interest in the evaluation. So if, for example, you're funding a service, you will be interested in the merit, worth, and significance of the program. But also, if you're providing a program, that might be your interest too. And, informing decisions about the future programming is important as well. So from a provider point of view, you will be interested in how well this is going and, what aspects work well, what aspects need further attention. And you'll be concerned about that from your own point of view and using the information you glean from the evaluation to make decisions around that. Now, if you are interested in reading further, and some very detailed texts are from Quinn Patton and Campbell Patton. They've been working on evaluation for the last 20 years or so, and they're really good in terms of further information on evaluation if you want some good texts. And they are particularly focused on utilization-focused evaluation. And I'll just talk a little bit about that. 1 second. So the concern with utilization-focused evaluation is that we don't just conduct evaluation for the sake of it. That people will actually use the findings of that evaluation in maybe decisions they make in how they conduct their work or whatever. So that the evaluation is actually used as an important consideration, and it's suggested that the only way that can be done is if we work very closely with those primary intended users in the design and the conduct of the evaluation. So, just think of yourself, who are the primary users of this evaluation and how are we going to involve them? It's a really important consideration. And then, the things that we focus on will be concerns that they would have about the particular program. So as I said, it requires a collaborative and inclusive approach to define what you will measure and how you will measure it. So why evaluate? Well, as I mentioned or alluded to a few minutes ago, accountability is one key reason why we evaluate. So if someone gives you some funding for a particular initiative, they will want to know that you have implemented that initiative and that it is doing what you said it would do. So, and to be able to account for that is important. So accountability is really good, but it shouldn't just be for the sake of accountability. It should be to help us make effective decisions. So, from your own point of view, you will need to know how effective the program is and make sure that the evaluation gives you the information you need from that. There's more recently, there's a particular focus on implementation. And sometimes you can implement a service and then you're getting the outcomes, but do you know how what you do on that service are contributing to those outcomes? So understanding those generative mechanisms are really important in terms of developing the service over time. So you will want to know what worked well. If you have in particular innovative pieces, you'll want to know how they contribute. And also you might want to share a good practice. So, very often someone is showing real progress in an area and others will want to know what it was that helped them to get to that point. We also need to be sure also that we are implementing what we said we would. So the implementation piece is important too. So, what might stakeholders want from an evaluation? So depending where you're coming from as a stakeholder, and just when we say stakeholders, we mean anyone who will have a genuine interest in this. Perhaps it's a service user, but perhaps it's someone who's funding it, perhaps it's someone who is responsible for policy, and this is important in terms of contributing to that policy. So depending where you're coming from, you might want different things from the evaluation. But generally, we're talking about either being able to ascertain or to demonstrate that a project has been implemented successfully, on time, within budget, and to agreed specifications, to ascertain or demonstrate that the program is fit for purpose, so it's meeting the needs of the target population, it's improving the targeted outcomes, it's responsive to changing needs, to determine if the program is good value for money, has funding been spent as originally planned, is the funding being used appropriately, effectively, and economically, are the outcomes justifying the spend on this particular initiative? And to determine that the program is acceptable to those who use it, that's a really important consideration. And so the user satisfaction piece is important. And finally, to determine how the program impacts on high-level policy objectives. So how does it contribute overall to equity in healthcare or to access to healthcare and quality and cost? So just getting to some of the things we might want to consider when we're designing an evaluation. And one really big issue is when is the right time to do the evaluation. So if you implement something new, you want to give it time to show, to bed in, to develop, and to be able to contribute to those outcomes that you're targeting. So you need time for that to happen. And sometimes you might have an interim evaluation. So you might want to say, well, after a year, we'll evaluate it, see how it's doing, maybe make some further tweaks, and then evaluate it again. So sometimes you'll have that smaller interim evaluation or evaluations, and then a big evaluation at the end. So you need to give the program time to establish properly and to contribute. And the other thing you need to think about is, are there other things that must happen for this program to be successful? So, for example, if you were to establish new facilities, would that need to be done, and would that need to be working effectively before you could begin to see the program establishing and so on? So, these are some of the things in terms of timing of the evaluation. Some other things you might want to think about are, in terms of, the scope of that evaluation, who conducts the evaluation, is what resources have you available? And ideally, if you can agree during the funding part of the initiative, a budget for evaluation, that's really helpful. Otherwise, you might be relying on staff. What time do they have? What expertise do they have? You might also want to think about how you can access the information that you require. So do you have the authority to access this information? Will you be able to talk to the people you need to talk to? Do you need to bring someone on board to get that type of access? And then and of course you may have access, but the people involved may not be willing to engage because maybe they don't trust you, they don't know you, and you might need to get someone on board to help with that. So just some of the things we need to think about before we get going. So if you look at various frameworks, you'll see that they largely follow a pattern. And this six-step approach is from the Center for Disease Control in the US. But I would say that generally this is the process that people follow. So the first step is to engage the stakeholders. So we mentioned earlier, for utilization focused evaluation, it's really important that those who are the primary intended users, either of the information or of the service, that they are engaged and they help to contribute to the evaluation design. So you might want to consult people within the service to identify who they are. You want to ensure that less powerful groups are also included. And their involvement should be involved. They should be involved throughout in terms of designing the evaluation and helping decide what you look at, helping to decide the questions you might ask, who you talk to, and so on. And then ideally they would be involved throughout the process, and maybe getting towards the at the end, how is that information used? They can help to make sure that it is used effectively. So engaging the stakeholders is really important. The other thing is, though, you need to be careful about this as well, because it can become a huge exercise in its own right. So you need to be careful about how you manage it. So when we say engaging stakeholders, is it the actual stakeholders or is it a stakeholder representative that you want, just to keep it manageable? So a lot to be thinking about in this. And of course, the more recent public patient engagement initiatives are really about trying to ensure that end users are also involved. The next stage then is to describe the program. So we can't decide, how we're going to focus this evaluation if we haven't really got a good sense of what the program is about. So maybe looking at various documents, maybe looking at policies, also talking to some of the people who are involved in establishing this initiative, and getting a sense of what the program is about. So you'd want to know about the mission, you want to know about the goals and objectives. Capacity to affect change is important. How realistic is it that this program is going to achieve these outcomes, and what are those outcomes? What are the expectations of this program? That's really important. We mentioned timing the evaluation and looking at the stage of development. That's important. Also thinking about how this program fits with the larger organization and the community and how it contributes to it, and also looking at activities and resources. So that's describing the program. Then we want to focus the evaluation. So how big is this evaluation going to be? What is it going to involve? Who is it going to involve? What sorts of information are you going to include? And what resources do you have? So thinking about who's the evaluation for, what aspects do you want to evaluate? What resources do you have? And we mentioned earlier the logistics, thinking about those too. So then we get to gathering the credible evidence. So, going out and talking to people, doing focus groups, interviews, surveys, case studies, whatever we decided are, the ways in which we want to capture that information about this program. Now, that isn't the end of it. We don't just go off then and write the report. We then need to look at what we've got and start to interpret it and use our stakeholders to try to make sense of that too. So you might want to look at the findings and compare them to other services and reviews that are similar, and then, sort of asking the questions around that. You might want to look at how what you found compares to best practice standards. You may want to look at how this compares to previous evaluations and what progress has been made or not in the meantime. So the contextual factors are really, really important in terms of making sense of your findings and coming up with those conclusions. And also then you might want to make recommendations about things to be, and commendations as well, of course, we mustn't forget about that. And then finally, the final part of it is to ensure use and share lessons. So of course, we want to include the stakeholders, the right stakeholders, and we want to include them throughout. Hopefully they take ownership of this, and they find there's some useful information in that they can implement themselves. Or you might decide to get going on some action planning, and that can be really useful, where we might say, well, look, based on these recommendations, we're going to try and do this, this, and this over the next while. We will set out some clear action points, and we will put a timeline to those and some people with responsibility, and we'll come back and review that. That can be very useful. You may also want to share your findings with others, both in terms of the technique that you've used and the different tools and what you've done and the findings. and that can be very useful. So just thinking, how we can ensure that the findings do get used to help inform decision making in the future. So just in terms of how we would go about all of this, there are lots of evaluation frameworks out there that can be useful. And I'm sure those of you who are involved in education, for example, will be familiar with Kirkpatrick's framework. So there are different ones you can use to help you focus your evaluation and think about what you're going to what questions you're going to ask and so on. I found a really good scoping review published in 2020 by Flynn et al. It's listed in the references at the end, where they did, as I said, a scoping review. They looked at different evaluation frameworks used for dietary change program evaluation, and they found 71 different frameworks. So, there's an awful lot of frameworks out there. If you think that's only 71 frameworks for that quite niche area. But they suggested that the frameworks are useful to facilitate a systematic approach to evaluation, to enable multiple stakeholders to gain a shared understanding of the programme and the evaluation process, to help identify and agree upon appropriate objectives and methods, to facilitate a more comprehensive evaluation, and to improve the fit between researcher-led and practitioner-led evaluation approaches. So I'll just show you this. That's their paper, and as I said, it is referenced at the end. And this is their typology. So they identified 3 different types of frameworks, depending on the focus of the evaluation. So the first one is frameworks intended. So A is frameworks intended for use in physical activity, dietary change, or behavior change programs. The second one, B, the big one, is frameworks intended for use in health promotion or public health programs. And the third one, C, is typology of frameworks intended for use in generic programs. And I've just blown up C there again, just to show you a little bit more. So they've, for these generic programs, you can see there's different types of evaluation objectives. So one might be an overall program evaluation, one might be specific evaluation element, and the third piece might be around program planning. So they've identified different frameworks that can be useful for that. I'm going to focus a little bit on the logic model because I've used those myself. I found them really useful. As just an example of a framework. So a program logic model or a logic model. This diagram is from Cooksey et al. And so you can see here that it's a flow chart where the attempt is made to plot out the different things that contribute to the outcomes and what those outcomes might be. So you've got the inputs and resources, which are the antecedents. They relate then to what happens on the program, the transactions or activities. And then they relate to the immediate outputs or shorter term outcomes. So for example, with your screening program or your vaccination program, the initial output would really be, what is the uptake? Okay, if people don't get involved and don't engage, well then you're not going to achieve the other outcomes. So the first outcome, your immediate outcome, will be that uptake. Then that might then contribute to disease levels or prevalence of certain diseases or whatever in the community. But it'll take longer then before we see how that really contributes to health more generally. So the longer term outcomes. So plotting these out can be useful in terms of deciding what we want to evaluate. What is it possible to evaluate in your evaluation if you're just doing it maybe a year or two into the program, but also the final piece of it is that to consider the contextual factors that influence those outcomes. So, we talked earlier about some of those things. So, for example, funding might be important, and the other things that are happening and how that impacts on the outcomes might be important too. So these are the things we consider in the program logic model in terms of focusing our evaluation. Now, I've just put up 2 references also in the references at the end, and this is just to show you an example of using the logic model. This was a piece of research conducted in 2012, 2013, where some academics from UCD and then midwifery managers and midwives and educators from the National Maternity Hospital worked together on a project to identify the outcomes of for the evaluation of the midwifery-led antenatal care. And then the second paper then reports those findings. So this is a nice worked example. The reason I put this up here is just to show the range of stakeholders who were involved throughout that process, right through to publication. Now, this was conducted a few years ago. Now we would say you'd really want to have some patient representatives there, which we didn't. But nonetheless, just to show you the range of stakeholders involved. So if I can quickly just go through the process. So what we did to begin with, we spoke to people who've been involved in establishing the clinic. We looked at the various documents around it. And from that, we identified what the background was, what the goals and objectives were, and what the inputs were. So the inputs would be service users and the various resources involved. Then we looked at the activities on the program. So essentially, it was to provide an alternative to women for the usual hospital-based care, and so recruiting women was an important part of that. The antenatal care, you can see the various types of care that was provided, and access was also seen as an important activity, ensuring that women had access to those services. And then the outcomes that we identified, you can see a range of different outcomes here: choice, relationship interaction with the maternity care provider, the experience of care, preparation and education for pregnancy and childbirth, effectiveness of care, organisation outcomes, including costs and benefit of the hospital, and then the programme viability. We thought that was an important outcome to look at as well in terms of the longer term future for the programme. So based on all of that, then working together with the group again, we put together this chart which was showing how those outcomes could be reflected in measures or indicators, and what would be the sources of data for this for the evaluation. So you can see here we've got a chart audit, we've got a survey, we've got interviews and focus groups, and we've got other. And the other was around the costs. So if I go down to the next sheet, you can see some more of those outcomes. So we did a clinic survey to look at the actual costs of delivering those clinics. And this was a comparative evaluation. So we had, a sample from the midwife-led antenatal care service, but we also had a sample from usual care. So there's the references are here. So this was quite a big evaluation. Your evaluation doesn't have to be this big, but we wanted it to be quite thorough. And based on all of these sources, then we were able to conduct the evaluation. So I'm going to leave it there, as I said, as just a quick introduction to evaluation. I know that you've been involved in evaluations in various ways yourselves, and you'll have various types of experience around that. So I hope you found that useful. And then I'm going to stop now and hand over to Gail, who's going to talk about her experience. But just before I do that, I just say in these slides, these are the references if you want to follow up later. Thank you.
Now, so just double checking everybody can see my screen. Is that working, Michelle?
Yes, you're fine, Gail.
Oh, perfect. Thank you. So thank you very much, Michelle. And it's really great to kind of have that really excellent in-depth presentation. And thankfully, there's lots of linkages in with my presentation now. So you'll kind of see it a bit more in practice on kind of a smaller scale. Okay, so I'm really delighted to have been invited today by Austin to present as my role really in Health Promotion and Improvement Officer, with a remit for research and evaluation in the Health and Wellbeing Department. So my background and training is research in academia. This includes a number of years working in various roles in research. So these are some of the projects that I was working on previously. In this time, I completed a PhD in Public Health and Primary Care, and this is one of the papers from that. So the topic was reducing sedentary behaviour, and I conducted 3 mixed method studies culminating in a pilot feasibility study of an intervention to reduce workplace sedentary behaviour in men, because they were the biggest sitters. So then 2 years ago, I came to the HSE to be involved in health promotion in practice. So I suppose key learnings from my research training and to bring into the HSE would be taking a systematic evidence-based approach, the fundamental importance of stakeholder engagement in the development and evaluation of any programme, And in terms of evaluation, the value of both qualitative and quantitative data really does provide the biggest, fullest picture of an impact of a programme or evaluation. So just in terms of the competencies of a health promotion officer, we can see here that research and evaluation really does underpin the work that we do. Given that my research role is completely new in the department, I've kind of spent the last year or year one as a scoping piece where I'm trying to figure out what types of evaluation are required, what's going to work, and not only what's going to work for us, but we're working with lots of different stakeholders too. So it's understanding their capacity in terms of evaluation. Also, does the evaluation complement existing evaluation methods already in place? What are we looking to capture and why are we evaluating this? So lots of questions really is what I had at this, as a starting place. So in this scoping year, one key piece of information from my role was determining what is research and what is evaluation. This is the table from HSE Research and Development and states that service evaluation is to assess how well the service is meeting its intended aim. And importantly, further down that table, it says no ethics requirement. So to note, there's actually no ethics committee currently in place in CH09. So for me, it was, how can we do this? So in practice, what I do is keep ethical considerations and of course, GDPR regulations at the forefront of my work. So this means ensuring no harm is caused to any participant or service user, being sensitive to participants in terms of stigma that may be present in a given programme, making sure not to overly burden participants with data collection, ensuring anonymity in the write-up, and importantly, I endeavour to make sure any data or information to be collected is absolutely required and going to be used for its stated purposes and not just for the sake of it. So with this in mind, these are the key tenets that are important in our work, and that's development, implementation and evaluation. Of course, the learnings from the evaluation should inform future and ongoing programme activities. So this is an evaluation framework which was created recently by a team in CH06, and it's a framework for health promotion officers who want to evaluate a programme. They also created a toolkit, and the aims of this are to support evaluations of programmes by providing a framework to follow, reducing time required for evaluation design, giving guidance on what needs to be looked at and when, ensuring consistency in evaluation across programmes. So this is what I'm going to be using with my team, and will provide a clear structure for evaluations in the future, which will be great. So leading on from that, a recent project that I was the research lead on was a food club pilot programme. And I was asked to be involved to guide on the evaluation part. So this was a 12-week pilot programme held weekly where people facing food insecurity came to a community resource centre and were provided with cooking demonstrations as well as other information sessions like financial advice. A key piece was the food shop. So this is where food items were sourced from a food cloud, who are an organisation to reduce food loss and waste through surplus food redistribution. The community nutritionist would collect the food from the food cloud every week and set up this shop where participants paid €5 for 10 items of their choice. And this was all linked into their cooking demonstration that they had that day. So the aims of the food club were to alleviate food insecurity, nutrition and health inequalities, fostering community engagement and support, and reducing food waste. So I was involved from the beginning and really got to know the partners in terms of who would be collecting some of the data along the way. So there was lots of stakeholder engagement, and they really were fantastic and really enthusiastic in the process evaluation part, which was great. So we used mixed methodology to provide the fullest picture of the barriers and facilitators of the project for the participants as well as the service providers. So I used pre and post quantitative measures about asking questions about food insecurity, nutrition, community engagement and food waste. On a weekly basis then, the community nutritionists completed a reflective journal on the issues that came up or observations each week at the food club. And this was really useful in providing a really interesting insight into the practicalities of the programme, as well as a good understanding of the contextual piece of the day-to-day running of the club in this particular resource centre. So towards the end of the pilot, I conducted a focus group then with participants. I came in a week before to introduce myself, describe what the focus group would entail. And so they had the week then to decide and consent to take part. Also reminding them that all information will be kept anonymous to me and that their perspectives really were important in informing future iterations. So I kept it quite informal, centering around their experiences of the programme. I also conducted semi-structured interviews with the service providers, looking at the barriers and facilitators of running the programme, and any key learnings that they wanted to share. So we got really very rich data on the experiences of all key stakeholders. So we're currently in the write-up phase of this, but I think it's going to be really useful and an interesting report feeding into future services. So this is just kind of a brief overview of the emerging findings. So in the questionnaires, the confidence ratings in terms of managing their weekly shop, managing finances and feeling stressed about feeding themselves and their families improved, which was great. Then in terms of qualitative themes, an improvement in nutrition and confidence in cooking was the experience of participants in the focus group, with one person saying they could just about boil or fry an egg before, and now they were cooking potatoes, vegetables and chicken. Another one was reducing food waste, where one couple described that they now cook their dinners in batches, where they cooked double the amount and froze the leftovers, and this meant less waste for them. And including that, then whatever their children didn't eat was frozen for the next week. But the main theme, I suppose, that really shone through from both the service users and the providers was the community support and engagement that the weekly meetings enabled. Every one of the participants really couldn't speak highly enough in terms of the bonding that happened within the group. They didn't know each other beforehand, and although they were hesitant at first, they all described the shared experiences of their situation, which made them feel like they were part of a group and not being judged. Some described it being the only social interaction that they might actually have all week. And one described it was more like having a laugh and a joke while picking up bits of information along the way. So it really worked for them. This was described from the community nutritionist too, who really witnessed and felt the energy of that as the weeks went on. So from the service providers' perspectives, key pieces were the learnings in terms of implementation along the way. Like even small things like the participants and the order in which the participants went in to do their shopping, as there was limited space in that room, was a learning, as it was felt that it was unfair that the same people were going in first every week. So themingly small things were important to solve for the smooth running of the club. So all of this was really fantastic to kind of capture what wouldn't have been seen in just a questionnaire. So I suppose then just my key messages are to highlight the importance of stakeholder engagement, and the HSC actually have a guidance on stakeholder mapping. The importance as well of describing the programme, including the rationale, aims, activities and resources. So the two community nutritionists are currently, as they have gone along, creating that manual for future iterations. Who is the evaluation for and what aspects are most important to evaluate? I will always highlight the importance of quantitative and qualitative data with all key people's voices included. The importance then of contextual information. What works in one place might not work in another, and it's important to understand these factors as much as we can. Make recommendations, of course, and disseminate the findings. So really trying to be maybe at local, but it's great if it could be on a wider scale, really then to use the shared learning and lessons in that. That is it from me, and thank you very much for listening.
Okay, thank you. Thank you for that, Gail and Michelle. I've been keeping an eye on the chat just in case anybody had any questions. So I'll let you all have a think for a minute as to whether there's any questions you'd like to ask. But I was going to try and kick it off with a question myself, if that's all right, maybe to yourself, Michelle.
Okay, sure.
So I was just listening to in your presentation. You mentioned context. Mechanism, and actually Gail then mentioned context, and I'm kind of fascinated by the fact that over the last 20 years there's been an emerging field of implementation science, because there's a recognition that, you know, actually we know the evidence of what works, but actually making it work in different systems is dependent on the context. So I just wondered whether you'd had any additional thoughts in terms of the context bit that Gail was referring to there.
Just in terms of implementation science, I was at a conference a little while ago, and there was a really good example given of an initiative in one Canadian hospital to introduce checklists in the operating theatre. And they found it had fantastic outcomes in terms of reduction of complications and mortality and so on. So they decided to roll it out to 6 hospitals. And they found the results in the 6 hospitals wasn't good at all. It was kind of, some had good outcomes, some didn't. So they went back and had a look and said, this can't be right. We can't just, checklists have to work. So somebody was employed to go out and talk to people involved and do some qualitative work. And they found that they talked to people and said, what was your experience of using the checklist, and what checklist? So what they found was that what was happening was that the implementation hadn't actually been implemented. And so that was why the outcomes weren't happening. And so if you think about this, it would be very easy to say, well, actually, no, that doesn't work. That was conducted over 6 hospitals. We know a good sample didn't work, and just to say no. So the implementation piece is really, really important to ensure that we have implemented what we said we were going to implement. And in terms of the context, of course, the context is going to be hugely impactful in terms of what can be achieved and what can't be achieved. So I think that as Gail was saying, the qualitative and quantitative piece I think is useful, but it's also useful not just to look at the outcomes, but to look at what happened along the way. Yeah.
Thanks, thanks, Michelle. And if anybody wants to stick their hand up on the webinar with any question, with any burning question, feel free to do that. I'm trying to keep an eye on here. While you're having a think, I was going to ask Gail a question. I'm probably going to make some assumptions that the food club was in an area of socioeconomic disadvantage. And I just wondered, are there particular considerations when trying to engage communities in disadvantaged areas?
There were kind of some of the questions that I asked, even in terms of, advertising it and kind of promoting it within even the participants, and they actually came up with really good ideas, in terms of really key places that people themselves, that they know as locals, would kind of know to see where things were being promoted. So that was like really key learning. I know that not even it is definitely that trying to kind of reach some people, and there's people that were unreachable. So this kind of did come up through some of the findings, but it is kind of something we're going to have to go back and look at really kind of more in depth. But these were really engaged cohort.
Okay. Frederick, I see you put your camera and you've turned your mic off there. Do you have a question?
I do, yeah. Hi, how are you?
Hi,
Yeah, it's not really a question. To be honest, this is my first time sitting in on anything like this. It's really interesting. You can hear me okay, can you?
Perfectly.
Yeah.
Yeah.
That's good. Well, first of all, I was just thinking of lack of communication in some of these programs can be very, it can be devastating, really, for the clients and all in the programs when they're starting up. And also multiple points of contact is another, where you have so many different people to go to try and get information from, and it confuses them totally. I feel this can happen as well, It's just really mostly a statement I'm making. Maybe I'm just throwing it out there,
Okay. I don't know, Gail, whether you came across that as an issue in the service you were evaluating?
I think because I was involved at the beginning, we kind of kept it nice and streamlined. So the service providers provided the service, and then I was the research person kind of guiding that, and it was only one other person, all kind of, to me, it was kind of, conducting that piece of work. So in this one, I think it did work really well, kind of keeping that. But I agree with you that it can be way too many people and too much.
It's like too many corridors to go down, too many things before they actually get the answer, or what they're actually just looking for, can be confusing. And I suppose the language now, especially with the way today is too, language and cultural backgrounds can be very difficult as well. The barriers there can be awkward as well,
Okay, thank you.
I think it's changing all the time now. It's a lot more,
Yeah.
Seems to be.
Okay, thank you, Frederick. Has anybody else any other questions they'd like to raise? David, you have your hand up. Or at least it says David on the screen, unless you borrowed somebody else's computer. No. Okay, is there anybody, I feel
Yeah.
like,
Oh, David's coming in, I think.
oh, hiya, David.
Can you hear me?
Yeah, we
Yeah.
can now, yeah.
Okay, okay. It's just a quick, I hope I'm allowed to ask a question, but take that example you gave of the checklist going to 6 other hospitals. I mean, that could be done from a local sort of evaluation aspect, or you could look at it as a hypothesis-driven sort of research project that says checklists are going to improve outcomes, and then you could do it for an academic journal. So I'm just wondering, what are the main points of difference between doing something like that as an academic sort of research piece, generalizable, and as an evaluation sort of project?
Yeah, no, I mean, there's lots of ways to do it. You can slice it and dice it in different ways. I suppose the point I was making really was about the implementation piece, that very often we assume things have been implemented properly and they haven't. So we need to look at the whole picture, the whole process, if you like. What are the activities that are happening? Are they actually happening? So yeah, that could be an evaluation of that, or that could be a piece of research. There's not a huge amount in it. I mean, they were, as I said, I was just an example of how implementation doesn't always happen.
Okay. Anybody else with a
Genevieve.
question?
Genevieve?
Yeah, hi, and thanks for the presentation. I was just wondering, does the HSE ever offer, or within this region, support with research, to generate that data? I'm just thinking of a new MDT that I'm joining, just in terms of getting that rich, meaningful, on the ground data. Is there a facility to assist with that in-house?
Michelle, I'll probably take that. I guess well, first of all, I'd say that this collaboration with DCU is an opportunity to look at that. And certainly in the first instance, if you're in the HSE, you can reach out to myself and I can have a discussion with you about that. But obviously the research supports as such within our own CHO. It is just me, but I work very closely with colleagues in DCU. So it is feasible, and sometimes actually a good starting point is to have a discussion about what it is you want to look at and what it is you want to try, and particularly in terms of evaluation. And I think it's important that we have that clear distinction between evaluation and research. They are two different but sometimes interrelated things. And so you're absolutely welcome to reach out to myself in the first instance in relation to that.
Okay. Thank you.
Anybody else with another question? It's going across 2 screens for me at the moment, so I'm trying to keep
I don't see any other hands up, and there's nothing in the
no,
chat. I'm just
Yeah.
Could I just take a second to remind people, and I've put it in the chat again, but you may not see it. Could you complete the evaluation at the end of this? It should only take you a few minutes to do it, and it's on SurveyMonkey, and there's a link in the chat.
Yeah. Okay, thanks for reminding that.
Yes.
Michelle, well, I think I don't know, Michelle, if there's any final comments that you want to make. Otherwise, I think we could probably start to wrap up.
Yeah, absolutely. Just to remind you of the next seminar, as Austin mentioned at the beginning, just in case you weren't there at the beginning. So this is going to happen on the 6th of March, and it's in the HSE office is in Ballymun. Isn't that correct, Austin?
It is in the Civic Chambers, if people are familiar with that venue, and it's arrival at 12:30 for a light lunch. And the reason it's 12:30 for the light lunch is that when you go into the room, you can't take the lunch with you. So if you want to have something to eat before the seminar, then you need to be there that bit early for that lunch.
And
there'll be an email going out. I think it's scheduled to go out tomorrow from the DNCC comms email with an Eventbrite link to get your ticket to join that event. So keep an eye out for that tomorrow.
And it's on evidence synthesis, isn't that correct?
It is, yeah. And we've a colleague, similar approach again as a colleague from DCU. And we have the librarian who's going to talk about library resources for evidence synthesis. So it should be an interesting we've got something else in the chat here. Okay, yes, the slides will be, a copy of the slides will be provided. And so I think if nobody
Michelle Murphy has a question there.
Okay, Michelle.
Sorry, it's just that link had disappeared, but depending on the screen for the evaluation.
It's in the chat.
Yeah.
Yeah, just click.
Yeah.
See, I've just clicked on it myself just to check it's working. So it is working. Hopefully you can access it, Michelle. Okay, will we wrap up there?
Absolutely. Thank you everyone for attending.
Yep, thank you very much,
Thank you.
everybody. And we'll see you hopefully in March.
Thank you.
Thank you.